Good afternoon and welcome to the Thorncliffe Park Mass Immunization Clinic. Today, I have the great privilege of welcoming guests from the provincial government. The Honourable Doug Ford, Premier of Ontario, the Honourable Peter Bethlenfalvy, Minister of Finance and President of the Treasury Board, retired General Rick Hillier, who's the Chair of the COVID-19 Distribution Task Force, and the Honourable Raymond Cho, Minister for Seniors and Accessibility. I would also like to welcome the many team members and volunteers that have made this mass immunization clinic at Thorncliffe Park ready and to be opened tomorrow. And I would also like to welcome my colleagues from the East Toronto Health Partners. This Ontario Health team, which includes over 50 health service agencies and 200 family doctors, has a long history of leveraging each partner's expertise to improve the health and well-being of East Toronto neighborhoods. Over the past year, these ties have been essential for mounting this innovative community response to COVID-19. As early as March 2020, our healthcare and community leaders, like Dr. Jeff Powis, Michael Garron Hospital Head of Infection Prevention and Control, and Dr. Catherine Yu, Medical Director of Health Access Thorncliffe Park, and the leaders of the essential organizations of the Neighborhood Organization and Flemington Health Center, pointed out that COVID-19 would disproportionately affect a densely populated community like the one we're standing in. So from the beginning of this pandemic, we have found ways to build neighborhood-specific approaches to stop the spread of this terrible virus. This response has included local COVID-19 testing in this very mall. To minimize the impact of a COVID-19 diagnosis, the East Toronto Health Partners set up supports, such as the food bank we see just steps away, which supports families struggling with food security. And with Canada's largest elementary schools just outside these windows, Dr. Janine McCready, infectious disease physician at Michael Garron, worked tirelessly with principals, teachers, and school board trustees to set up school-based COVID-19 testing to enable these children to continue learning. And now, this community is welcoming Toronto to their doorstep to receive doses of the COVID-19 vaccine in this mass vaccination clinic. Starting tomorrow, we will receive more than 1,000 people every day with sleeves rolled up. Every ounce of vaccine administered in this hub will bring us one step closer to embracing our loved ones, sharing a meal with friends, keeping our kids safe in school, and bringing back our much missed neighborhood celebrations. And let me tell you, the celebrations in Thorncliffe Park are like no other in this city. And then, when our vaccination program winds down, we will begin the renovation of this space to become the Thorncliffe Park Community Hub, where local health and social service organizations will be consolidated and rebuilt to better serve this incredible community. This will be the home of primary care, midwives, settlement and employment services, a legal clinic, and more to enable the residents to take community wellness to a whole new level. I know, Mr. Premier, that you put a lot of value in connecting with the people of Ontario. The resilience, innovation, and courage of this community and its leaders has guided the East Toronto Health Partners to stay ahead of this devastating virus. Let me tell you, this is a great example of Team Ontario at work. I would now like to welcome the Honourable Doug Ford to share his remarks. Premier Ford.
Well, good afternoon, everyone, and it's always great to be here in Thorncliffe Park. And you know, before I started off here, Sarah, you talk about a true champion, you know, blazing a trail, and just talking to General Hillier before this, and right from the get-go, it was Sarah and her whole team that just took off out of the gate. And here's a perfect example of true leadership. I also, I'm sure I'm going to say this in the little speech here. This is an incredible community. Number one, this is going to be the community hub in the future, the Thorncliffe Park Community Hub. They have the food bank going on. So I want to thank them over there. And I got to thank all these folks over there. This would not be possible if all the folks over on the other side, and thank you so very much, set all this up. It's a real Team Ontario effort, as Sarah was mentioning. And I'm joined by Minister Bethlenfalvy, Minister Cho, and General Hillier. I want to say again, thank you to Sarah Downey, CEO of Michael Garron Hospital, for the kind introduction. I have to tell you, they've been doing exceptional work here to set up this mass immunization clinic. As I just mentioned, it's the great folks to my right that have done that work. And again, we're very grateful. And I need to give a shout out to the East Toronto Health Partners, another partner, incredible partner. It's amazing when everyone works collaboratively together for what they've been doing to protect our seniors in East Toronto. What they did, they showed me a map, and they get into mobile units going into these seniors' residents, and incredible work. They were one of the first to administer second doses to all eligible residents of long-term care and the retirement homes in this area. They also launched a mobile clinic that administered vaccines to over 500 seniors and healthcare workers in high-risk settings over 3 days in February. And when the clinic opens tomorrow, they have it set up to support our seniors. And that's vital because protecting our most vulnerable is our top priority. In our 2021 budget, we will be providing $3.7 million to help seniors and people with disabilities get their vaccinations. Just like our friends here at the Mass Vaccination Clinic, we will make sure that anyone in Ontario who wants a vaccine gets a vaccine. And we're making tremendous progress in our province-wide rollout plan. So far, more than 1.6 million doses of COVID vaccine have been administered. That's almost 300,000 people are fully vaccinated with their second dose. More than 250 vaccination sites are planned for this month. That includes more than 150 mass immunization clinics like the one we toured today here in Thorncliffe Park. But I'll say it again, we need that steady supply of vaccines from the federal government. They need to keep up with our ability to put needles in arms. This clinic behind me has 60 staff and will have the capacity to deliver up to 10,000 doses a day. And that's just one clinic. We're ramping up quickly, and we need every clinic, pharmacy, and primary care setting administering the maximum number of doses every single day. We have our top performers ready to hit the ground running. We have Team Ontario. We just need more vaccines. Again, I want to thank everyone here for making this possible. You're doing incredible things for your community. And I'll close by reminding everyone who is eligible and wants a COVID shot to please book your appointments. You can do so through our local public health unit or by going to ontario.ca/bookvaccine or call the toll-free number at 1-888-999-6488. Thank you very much, and God bless the people of Ontario. Now I'm going to hand it over to the most popular guy in Ontario, the guy with all the cash. He's going to roll out a great budget tomorrow, and it's going to be a great budget for the people of Ontario. Pass it over to Minister Bethlenfalvy.
Thank you, Premier, for that introduction. And there's a little bit more where that came from for the people of Ontario. And then thank you, Sarah, for everything you and the team has done here. The Premier's right. Tomorrow, I will introduce the next phase of Ontario's action plan in response to COVID-19. It is our government's second pandemic budget and the next step in our plan to protect people's health and support our economy. It will provide the resources necessary to finish the job we started 1 year ago. And we'll finish the job by getting vaccines to every person in the province who wants one. Under the leadership of Premier Ford, Minister Elliott, and Mr. Jones, and General Rick Hillier, we continue to make steady progress in the execution of our vaccine distribution plan. I encourage everyone I meet to get vaccinated just as soon as they can. It is especially important for older adults and vulnerable people. The COVID-19 pandemic has disproportionately impacted people with disabilities and seniors with mobility issues. Often, they are without independent means of transportation. They may rely on accessible public transportation, and traveling long distance by taxi or ride sharing is not an option. So we are going to remove this barrier. We will quite literally drive you to your vaccine appointment, because a lack of transportation should never get in the way of something so important. As the Premier said, our 2021 budget will include $3.7 million in funding to help provide safe and accessible transportation to those who need it the most. Our government is working with local transportation providers to implement this vital service. This support will ensure that seniors with mobility issues and people with disabilities who want to get a vaccine can go get it and protect themselves from COVID-19. Ce soutien fera en sorte que les aînés à mobilité réduite et les personnes handicapées qui le souhaitent puissent se faire vacciner et se protéger contre la COVID-19. I know this past year has been hard for so many Ontario families, but there is hope on the horizon. We are all working together to defeat this virus, to keep our loved ones healthy and safe, and support our workers and job creators weather this storm. So thank you everyone for doing your part to keep each other safe. And I'll now hand it over to the great Minister of Seniors and Accessibility, Raymond Cho.
Thank you, Minister. Good afternoon. I'd like to thank each of you for taking the time to join us today. COVID-19 has been a tough adversary. It has pushed our most vulnerable to isolate in order to stay safe. It truly has been the challenge of a generation. Our government moved quickly to implement support to help those most in need while they have had to isolate. COVID-19 may be tough. Together, we are tougher. Now, we are seeing the light at the end of the darkness as we race to vaccinate as many Ontarians as possible. Premier Ford has committed that everyone who wants a vaccine will get one. Today, we are excited to share with you how we are working to ensure that no one is left behind as we move together toward a bright future. We are almost to the finish line, and with your help, we'll make sure everyone gets across that line together. Thank you.
Good job, Raymond.
We'll go to the phone line for questions. First question, please.
Randy Rath, CHCH-TV.
Hi, Premier. I'm wondering if we could get some more detail on what Mr. Bethlenfalvy was talking about on using transportation companies to drive seniors and people that have mobility problems to get the vaccine. Are you talking about using like Uber or taxi companies, or what exactly are you talking about? Can you give us a little bit more detail?
The person to be able to answer that is Minister Bethlenfalvy.
Well, thank you. As I mentioned in my remarks, this program will be working with transportation partners. And so we're working out the details, but it'll work with the numerous people that are already working to get seniors into their vaccine locations. Not everyone can do that. And of course, as I believe General Hiller has mentioned, there's still a third of people over 80 who haven't been able to get vaccinated. So if this will help them get vaccinated, we'll work with transportation partners to make sure that they can get it.
Follow up?
Yeah, okay. And today in Hamilton, and yesterday, we've had a problem. We've had many viewers call us and say that there's, when they call in to try and book an appointment, that they are told that there are no appointments, no vaccination appointments left in this month and the next month, And also, when they try and book online, they're asked to book a second shot, and when they do that, it tells them that there's none available and kicks them out of the system. So there seems to be a flaw in the system. We asked the Solicitor General about this today, and we asked the health officials, and they seem to have no idea what we were talking about. Have you learned anything about that? They said they'd get back to us, and nobody has gotten back to us to explain what's happening and how they're going to fix it.
Yeah, Randy, I'll be able to make sure we get the right answer. First time I've heard they're having a problem over in Hamilton. I know we booked well in excess of 190,000 appointments in one day yesterday. But we'll look into it because there has to be times available. We obviously need more vaccines, as I always say, but we got a good shipment of Pfizer's in today. We're expecting some Moderna's in on Thursday, and we're ramping up. But maybe I'll pass it over to General Hillier and see if he's heard of any issues in Hamilton.
Premier, thank you. As the Premier said, in the last 36 hours, we booked more than 200,000 vaccination appointments across Ontario. And so now we have well in excess of 500,000 appointments booked for vaccines going out. There have been a few small glitches in some of the online booking system. By the time I asked the team about it, they had already started working to find out what in the coding was causing the problem and we'll have it fixed by the end of the day today. So any of the glitches that we have encountered, we'll have them fixed by the end of business tonight and be ready to roll again tomorrow so that we can book every single appointment for a vaccine as soon as is possible and get people to level up protection that we want them to have. And I'll just comment upon it. I think what the minister has said, when we look at the 80 and overs in Ontario, we've had an incredible level of success. And I want to use that opportunity to thank the professional medical staff and teams around Ontario, not just those that are here today, but right around Ontario, whose planning and whose work have allowed, supported by thousands of others, have allowed that to occur. Out of 640,000 80-year-old and above in Ontario, by the end of the day, we will have vaccinated 450,000 of them, and we have 125,000 appointments for 80 and older already booked. So we will move to that population and concurrently start with the 75-year-olds and older, as we have already done, and as we started booking appointments yesterday. So the IT system is working almost completely beautifully, booking 200,000 appointments in 36 hours, and any glitches we'll have solved, we'll have rectified by end of work today. Thank you.
Next question.
From Holly McKenzie at the Canadian Press.
Hi, Ollie.
Hi, just wondering if you could break down a little bit more. It says the program will involve transporting people to sites and in some cases bringing vaccines to people. So I'm just wondering if you could kind of give us a sense of that division and how much money and resources will be going to both those aspects of the program.
Well, they're going to be run separately. They'll have the mobile units, which already are out there. I got a call from someone yesterday saying that a mobile unit went in and vaccinated their mother. So that's good news. And as we heard here through Sarah and her team in February, they had 500 people vaccinated. So that's separate. We're going to be rolling out the details in the next day or so on the funding that we just announced today. So once we get that squared away, we'll make sure everyone's aware of it.
Follow up?
Yeah, do you have a sense of when this will start?
I'll ask Minister, do you have an idea? Go ahead.
So thanks again, as soon as possible. This is a pre-budget announcement, so we didn't want to wait till tomorrow. Raymond Cho, our great minister, is responsible, working with multiple ministries, Ministry of Transportation, Ministry of Municipal Affairs and Housing, Ministry of Health, to get the logistics. This is an important effort because as the General said, we want to encourage everyone that's willing and able to get the vaccine to make it simpler for them to do. There's multiple ways to do that, and this is just another way that we're going to make it simpler for them to get vaccine, because that job is our number one job in this province, is to get everyone who wants a vaccine to get vaccinated, and that's why we've set up this infrastructure with all these great people here. And this is another piece of that strategy. So thank you for the question.
Next question.
From Dave Woodard at Global News Radio 640.
Hi, Dave.
Good afternoon, Premier. Canada's Chief Science Advisor says that the research right now doesn't support delaying the second dose of the vaccine for seniors and those with pre-existing conditions. What do you make of those comments?
Well, again, I take my advice off the Chief Medical Officer, Dr. Williams, and the health team there, and they're saying it's safe. We're going to listen to the Chief Medical Officer, and if things change, then we won't. But really, what it comes down to, we won't have to wait 4 months if we get more vaccines. We're in desperate need of vaccines. We can output 9 million vaccinations every single month, and the quicker we get more vaccines, the quicker we're going to be able to get second doses. And that's not, in all situations, this 4 month period, because again, there's a tremendous amount of people, not to mention the 300,000 that we already gave double doses to. But I talk to people every day. There was a person today that told me that their mother is going to get the second dose in about 3-4 weeks. So I guess it all depends on how quickly they're moving in each region.
Follow-up?
Thank you. My follow-up is for my colleague, Matt Bingley at Global. Are restaurant workers and taxi drivers included in phase 2 of the vaccination rollout? And what would you say to other people who can't work from home, who are left off this list, wondering how they're going to be able to work safely?
Yeah, it's just got notice that the restaurant workers are going to be in phase 2. I'll confirm that the taxi drivers, they played an incredible role too, getting people from point A to point B. But to confirm, yes, the restaurant workers are going to be vaccinated.
Next question.
From Laura Stone at the Globe and Mail.
Hi, Laura.
Hi, Premier. I wanted to hear your thoughts on the budget as Premier, of course, and then perhaps Minister Bethlenfalvy can weigh in as well. I'm just wondering, I'm wondering how your government is balancing all the considerations. You've got the fiscal hawkish side of the party that says this level of spending is not sustainable. Then you've got calls to spend even more on education and programs such as sick days. So is this a budget that deals with a crisis, or is this going to be looking ahead to recovery and potentially curbing this record spending down the road?
Well, it's a recovery budget looking where we're going to be down the road. There's two aspects, protecting lives and protecting livelihoods, making sure that we think of the future when we open up the economy and get things moving, getting people back to work. But I said right from day one, I will not hesitate to spend whatever it takes to protect people's lives. Very, very simple. I never waver from that. This is a priority. Once we get things moving, there's one thing I'm confident about is the economy. Not all of us can control COVID and the variants coming back and forth. We're doing a great job in making sure we vaccinate and as quickly as possible and test. But I have the confidence in the people of Ontario. When we open up the economy, we did it before. We were leading North America in job creation, economic development. We'll lead it again. Our biggest challenge before, we were short 250,000 people to fill all the jobs before we went through this pandemic. But that's one thing I'm confident we will turn this economy on, the likes of which this province has never seen before. And not us, the people, small business owners, medium-sized entrepreneurs. We'll get the place rolling. I'll guarantee you that.
Follow-up?
Okay, great, thanks. And perhaps Minister Bethlenfalvy, you can answer the follow-up. I'm just wondering if you can tell us are you making any dramatic changes or investments in childcare, and are you actually going to cost out your government's previous promise to phase in 4 hours of direct care for long-term care residents?
Well, Laura, first off, just to answer a bit of your first question, and I'll answer your second question. The Premier is 100% right. The best stimulus for reopening the economy is a vaccination and keeping people safe. So that job is not done yet. We're going to be very focused on finishing the job, defeating this pandemic. And to do that, we are definitely investing and protecting in people's health, whether it's hospitals, long-term care, mental health and addiction, women. So we'll have a lot more to say about that tomorrow. The second piece, of course, is supporting jobs, because as you just heard from the Premier, many small businesses have been hurt significantly. They're the engine of the Ontario economy. They're the identity of many of our communities. So we want to support businesses. We want to support jobs as we get to a position where we can, as the Premier said, reopen the economy even greater than ever before. With regard to the childcare, with regard to the hours of care and all those issues, I'd ask you to just hang in there a little bit longer, Laura. There's about 24 hours to go. In fact, 24 hours on the nose. So I'm sure you'll be following. And I just would like to say to the people of Ontario that the Premier made an unconditional promise to all Ontarians a year ago that we would do whatever it takes to protect the people from this pandemic and spare no expense. And I've got the privilege to be the Minister of Finance and President of the Treasury Board to support him and all our colleagues and all the people of Ontario to get that job done.
Last question.
From Michelle Mackey at 680 News.
Hi, Michelle.
Hi, Premier. Thank you so much for taking my question.
Thank you.
With outdoor dining now allowed in Toronto and Peel region, where are you at in terms of deciding if other activities like fitness or haircuts will be allowed outside as the weather continues to improve?
So those items are coming to cabinet tomorrow. In saying all that, it was really nice to get out. It was beautiful weather, but I can't stress this enough. Please, we have to be cautious. Am I nervous about the third variant? Or absolutely I am. It concerns me 24/7. So please, folks, yes, it's great to get out, get fresh air, but we have to be vigilant. I just can't stress it enough. And make sure that we follow the protocols from the Chief Medical Officer. Mask, wash hands, keep 2 meters away, 6 feet away. Please, folks, it's absolutely critical that we do this, because none of us want to go back to another lockdown. It'd be absolutely terrible. We have to keep an eye on the numbers. We've got to keep an eye on them like a hawk. So please be cautious. That's what I'm asking the people of Ontario to do.
Follow up?
Thank you. And perhaps this is a question for General Hillier. I know you've been asked about this before, but we're learning more about the vaccines and the virus. What % of Ontario's population needs to be vaccinated before we really begin to ease restrictions?
Well, I don't have a percentage in mind, and we've not worked to a specific percentage, except we want that every person in Ontario who is eligible and who wants the vaccine to have one. And then we'll see what that percentage is and what level of protection that gives us in the eyes of the medical professionals, who will tell us whether we've achieved what's called herd immunity or not by then. But if we give every person who is eligible for a vaccine the opportunity to get it, which is the mission of the vaccination rollout, and then they take it, we will get that level of protection across the province itself here. So there's no magical number that is going to give you protection across the bulk of the population. Everybody who's eligible will give you an opportunity for the vaccine. And please, if you're eligible, go get the vaccine and give yourself and the ones you love most and the people around you that level of protection that all of us want. Thank you.
That's great. Just right before we wrap up, again, I just want to give a shout out, Sarah, your whole team again. I want to give a special shout out to the primary care docs, the family physicians. They're incredible. Not only are they taking care of their practice, but thousands of them are jumping in here, helping out in these mass vaccination centers. On top of that, as soon as we get more vaccines, we're going to roll more into the primary care doctor's office. So they're doing incredible work, and sometimes people don't realize, the double duty, triple duty that they're doing. So I'm very grateful to their primary care docs and everyone, nurses, PSWs, volunteers, food banks, so on and so forth. Folks, we're going to get through this. We're going to get through this. Again, we always say we see the light at the end of the tunnel. That light is getting brighter every single day. But what a great feeling it is to see everyone working collaboratively together, no matter if it's 3 levels of government or hospitals working with PHUs, and it's just an incredible feeling. We're unstoppable, Ontario. We've stood up. Everyone has stood up, and we really went at this pandemic full steam. So I'm so proud of each and every one of you, And again, thank you. Please, please be cautious, and God bless again. Thank you.
Thanks,
All the best.
everyone.